We are now 2 weeks away from the state's near total abortion ban going into effect. Part of the new law requires all abortion services to be done at a hospital-owned setting.
Yeah, and tonight the state's largest healthcare system is speaking out on how they've been preparing both staff and patients for what comes next.
WRTV's health reporter Nikki DeMentri joins us in studio tonight to break it all down. Nikki.
Hey, good evening, Mark and Nicole. Now, under the new law, abortions will only be allowed in that hospital-owned setting. That means inpatient or outpatient. It won't be allowed at clinics anymore. Now, according to a state health report right here, last year, 6 hospitals performed the procedure, 4 of them being IU Health owned. That's all in the Indianapolis area. Now, today I spoke with the health system. They're telling me they're prepared for what happens next.
After 5 weeks of intense work with 60 senior leaders and hundreds of patient hours, we're prepared.
Leaders with Indiana University Health say once the new abortion legislation was signed into law, they got to work.
We thought it was very important to quickly formulate a team and a response, which we call the implementation team.
Over hours of meetings, some daily, others several times a week, teams under an incident command structure formed how providers will proceed. They ran through some 80 issues involving the new law.
One of our main goals was to ensure that our providers felt comfortable and that they felt supported and had as much information as possible going forward.
But leaders acknowledge there may still be gray areas.
It is hard to legislate medicine because every patient situation and circumstance is very unique.
That's part of the reason IU Health created a rapid response team. 24/7, a clinician, someone from IU Health's ethical team, and a person from their legal team will be on standby for any questions that may arise.
So in the event that a healthcare provider has an urgent legal question related to provision of abortion services, the rapid response team can be called for an opinion and advice.
IU Health says it will review what comes out of real-time situations after the law goes into effect.
I think that what exactly is going to happen after September 15th is, for all of us to learn as it happens.
Now, Indiana's Attorney General Todd Rokita spoke in a Facebook Live. This happened just before IU Health's briefing earlier this morning, responding to a lawsuit filed by abortion providers in an effort to block the law from going into effect earlier this week. Rokita says his office will not back down and there is no constitutional right here.
And Nikki, there have been some concerns about attracting and retaining the state's workforce as well as companies once this all goes into effect. What are you hearing about that?
So we know earlier this month we heard from Eli Lilly and Cummings. Those are 2 of the big companies that came out with concerns regarding staffing issues. Now I asked the Attorney General and IU Health about possible staffing concerns. Here's what they had to say.
I have not heard that it's a problem anywhere. I can't, and I don't think any Hoosier employers seriously think that they're going to lose employees because someone can't get an abortion here in the state of Indiana. It's just not an issue. And again, I go out around the entire state.
We also have a few cases where we have been recruiting out-of-state providers who have withdrawn from the process because of passage of this bill.
I did want to follow up with additional questions for Rokita. However, I wasn't able to during the Facebook Live. Reporters were asked to submit questions via email. In my case, only 1 of 3 questions was answered. Reporting in the studio tonight, Nikki DeMentri, WRTV.